Hello and welcome everyone to today's Spotlight series. I am Colleen Ferris, Director of Innovations and Strategic Development at Healthcare Excellence Canada. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I'm hosting this webinar from Ottawa, Ontario, the traditional and unceded territory of Algonquin people. Before getting into today's session, a few housekeeping items. Please note that this session is being recorded and we are pleased to offer French simultaneous interpretation for this session from the team at Boostlingo. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If at any point you need support at any time during the webinar, you can reach out to one of our tech support using the chat feature. English participants may choose to view the auto-generated live transcripts or subtitles throughout today's session by clicking the CC Live Transcript button from the Zoom menu at the bottom of your screen. French subtitles cannot be viewed live, but we are pleased to make both French and English captions available on the session recordings. Now, about today's Spotlight series. This is an opportunity to have focused, constructive discussions and explore solutions to make improvements last as we work together to shape the future of quality and safety in healthcare across Canada. Today's episode is titled Caring for the Carers, Improving the Psychological Well-Being of the Health Workforce. As part of HEC's work on patient safety and equity, we're adopting a new way of thinking and approach to safety that recognizes that the mental wellness and health of the workforce is deeply entwined with quality and safety of care. Today's webinar, you will understand how mental health of the workforce is connected to quality and safety of care, and to learn and hear about initiatives and strategies that improve mental well-being and health. We invite you to share your questions and comments during today's webinar using the chat box. And please, in either French or English, we have a large number of registrants for this webinar, and we expect many questions. We'll do our best to answer as many as possible, recognizing we might not have a time to reach all of them. We also want to take a moment and recognize that for many members of the workforce, there's been so much. Therefore, as we jump into this webinar, we want to ensure that you take good care of yourself during this time together and recognize that these topics may be difficult for some. I invite you to bring in the foreground what helps you to feel grounded and safe, and we invite you to do what you need to stay well, including taking a break and breather during this session. We've also added some mental health resources in the chat that are available to all. I'd now like to take this time and introduce our panelists and opportunity for them to introduce themselves. And so today I'm happy to be joined by a great panel, and I'll introduce them and then I will go around and ask each of them to just say a few words about yourself. Philippa Dawood is a wellness specialist from Scarborough Health Network. We have Ainsley Young, Executive Director Operations from Switch BC, and Ivy Bulgo, Director of Healthy Professional Worker Partnership and a professor at the University of Ottawa. So Philippa, over to you.
Thank you so much, Colleen. And it's really wonderful to be here and have an opportunity to speak to so many people that are hopefully equally as passionate about wellness as I am. I've been the wellness specialist and lead of this program at Scarborough Health Network for just over 6 years now, supported by an immense leadership team for our people division, and have a wellness coordinator that works side by side with me. So really looking forward to today's discussion. Yeah, thank you for having me.
Thanks, Philippa. Over to you, Ainsley.
Hi, good morning. It's morning here on the West Coast. My name's Ainsley Young. As Colleen said, I'm the Executive Director of Operations for Switch BC. I use she, her pronouns, and I'm honored to be calling in today from the traditional territories of the WSÁNEĆ people, the Senchossan speaking people on what is colonially known as Vancouver Island. I'm really honored to be with this esteemed panel and hear lots of wonderful questions today. I know how busy everyone is, so the fact that you're taking time for yourself and to join this is really exciting. As I said, I work for Switch BC. That stands for Safety, Wellbeing, Innovation, Training, and Collaboration in Healthcare. We're a pretty new organization here in BC, aimed at supporting the health, safety, and well-being of the over 300,000 healthcare workers in our province. And we were created with equal partnership from the major bargaining associations here in BC, the union partners for healthcare workers, the employers, health authorities, Safe Care BC, as well as Doctors of BC, the Ministry of Health, and WorkSafe BC. And it's important I name them all because they're all incredibly important partners. I'm here and excited about this work because I come with a background of about 10 years working in quality and patient safety. And in that time, I had the opportunity to lead quality improvement with team members, but I also had the opportunity to sit with patients, families, and care team members when they had experienced harm in our system. And what I saw through those experiences, how much healthcare workers and team members sometimes put themselves in harm's way to deliver the best possible care. So I'm really excited that this conversation is happening and that there's more recognition and understanding of the importance of mental health and psychological safety in the workplace. Thank you.
Thanks, Ainsley, and great overview and understanding of who is Switch BC. Over to you, Ivy.
Great, thank you so much. So as I mentioned, I'm Ivy Bergeau. I'm a professor in the School of Sociological and Anthropological Studies here at the University of Ottawa, where I'm situated, unceded, unsurrendered territory. And building off of what Ainsley said, I use she, her as my pronouns. I hold here a University of Ottawa chair in gender diversity in the professions. As colleague mentioned, I lead the Healthy Professional Worker Partnership for at least another few months. And from that project, we received funding to create a health worker burnout toolkit. And part of that is linked in with the work that I do as the lead of the Canadian Health Workforce Network. So I'm really looking forward to our conversation today. Thank you.
Thanks, Ivy. And I'm actually going to start, and certainly, where we turn to news and other places, we know how is the mental, we hear lots about how is the workforce doing, and we see this in many different ways being displayed. So maybe Ivy, I'll turn to actually you first to start this off. How, from the work you've been doing, what would you share with us as how is the mental health of our workforce, Canadian workforce, health workforce right now?
Yeah, well, I think it's really important to be honest. It's bad. It's getting worse. And I know that those are not pleasant words to hear, but the last thing that we need to do is gaslight our health workforce by saying everything's fine, because it's not. They're not fine. And so what are the indications of that? One of the things that we've done at the Canadian Health Workforce Network is we scan the literature on what has been written about health workforce in Canada. And in 2023, there has simply been an explosion of articles focused on the mental health of health workers. Just insert anyone. And this is not just, nurses, it's physicians, it's pharmacists, it's occupational therapists, dental hygienists, it's the entire workforce. There's just an article after article after article in this area. Now, keep in mind, articles that are written in 2023 are typically looking at data from 2021. And so then, you look at other anecdotal information. And, anecdotal information is sort of what we hear, from folks, what we see in social media. I'll make reference to a TikTok that was sent to me recently about how sort of early career health workers are told by their mentors, if they're so lucky as to have a mentor, that in order for them to be able to manage their position, they need to go on antidepressants. And so that's pretty telling that your health workers need to be on antidepressants to kind of cope with the situation that they're working in. And so, social media is available for the public to see, and the public is worried about this. A poll that we, were provided in 2022 is that the public, 90% of the public is worried about the mental health of health workers. And 8 out of 10 of them, so 80%, are concerned about what that means for them in terms of access to the system and in terms of quality of care. And so those would be some indications about what the situation is out there.
Thanks for that, Ivy. And certainly, we know it's exploding, and as you said, the evidence in the articles, but for many that have, are in the workforce and those that are seeking care from the workforce, we see it firsthand. And I think it's also, over the past, really shifted a conversation that we haven't had necessarily in the workforce. And I know, Ainsley, you and I have had opportunities to have conversations and discussions, but just we're hearing a lot about moral distress and injury. And so just from your perspective, what does this mean? It wasn't original something that was used within the health workforce, but certainly something we're hearing about more now.
Yeah. Ivy, I really appreciate your calling in not to gaslight and sugarcoat this. So we know that our healthcare workforce and folks working in healthcare are doing an immense and incredible job, and it's very challenging our system. And I think it's really important to kind of understand the concepts of moral injury and moral distress, because they do walk alongside concepts that I know Ivy's really passionate about and done great work, like burnout. So I really love Dr. Wendy Dean's definition and work on moral injury and moral distress. Shout out to the Switch website. You can see a webinar from Wendy on there. She's a psychiatrist based out of the States who does a lot of leading work in this space. And she really helps to define moral injury as bearing witness or having to make choices that go against your deeply held moral beliefs. So having to bear witness or to make acts or make choices that fundamentally go against your core. And they occur as individual pieces like moral distress, and then they compound into moral injury. And I think when I speak to healthcare workers, one of the things that they hear when they hear about this concept is it really helps to name what they've been maybe feeling and haven't been able to put a name on it. And we see it a lot in healthcare and have seen it for a long time in healthcare. So it's the nurse who's had a great shift, who's walking away at the end of the day, but also sees that the staffing level is really low and their patients and their teammates are going to be really stretched over the next 7 to 12 hours. In the pandemic, we saw a lot of incidents of moral distress and injuries through having to keep up with rapidly changing protocols, having to go in without PPE, having to tell families that they can't come and visit, and then watch patients be alone. Those are actions and bearing witness to deeply held beliefs. I think it impacts healthcare workers in particular and us in healthcare because we chose to come into this work for reasons other. We chose to come in for healing, for care, because we have deeply held moral beliefs. And I also, when I speak to folks, I think it's really important to call in the wonderful CSA standard for psychological health and safety. It's a gift to our country. We were leaders in creating this standard in our country. And when the standard was developed, it looked at many different industries. But what I find fascinating and interesting is that through that development, the group that developed the standards named 2 additional factors specific to healthcare, only in healthcare. One being support for your psychological self-care in your workplace, and the second being protection from moral distress. So I think there's a real key connection with healthcare workers.
Thanks, Ainsley, for that important framing and that connection piece. And I know there was a question in the chat about Ivy's, the burnout toolkit that Ivy, thank you, Ivy, for putting in the links. I think some of the team members did, and we'll certainly be sharing this, that resource along with a lot of other resources following the webinar as well. Philippa, just given, what's been shared here, and certainly where you're coming from and being so connected with point of care, And,
Yeah.
you know, seeing that connection to the psychological health and well-being of the workforce, but also what that means for patient outcomes. And I know there was even some comments of in the chat as organizations do Zumba classes and that, but that's not necessarily the fix. So maybe would love to hear your thoughts.
Yeah, definitely. You know, there's a lot to unpack, and thank you, Ivy and Ainsley, for sort of setting the stage. And I think what I want to start by saying is, you know, I'm gonna say a quote. You know, when you look at your greatest asset, when you consider your greatest asset, they will look after your patient, service, or product. So what does that mean? How do you translate that into practical work, whether you're doing wellness off the side of your desk, or you're actually, like a lot of us on the call today, in the role of the wellness SME or specialist or coordinator or consultant? And I think, you know, I want to start by, you know, speaking to the standard. But, you know, we are gifted with it. It's a wonderful document. And for those of us on the call that may also be certified in occupational health and safety, which I also am, you may be familiar with the Green Book, as we refer to it in Ontario. The standard is the voluntary guidelines, but they are equal to the law, which is the the Occupational Health and Safety Act, but it's for psychological safety. But I really want to stress that that also includes physical safety at the many levels of the organization. So it's so important that at the very top that we look at that standard as a reference and think about how can that help design our values and mission and create that statement. Because at the people leader level, when we're looking at redesigning or refreshing or developing, if you're a brand new organization, maybe not have that a strategy. What is your people strategy? Does that include an element or a statement that supports psychological health and safety? And it's a lens. It's a lens we have to adopt. It's not all of us in wellness or running the outputs, the education, the activities, such as it is, so i.e. the Zumba. It has to, when you implement the standard or bring in that lens of psychological health and safety at the very top level, it identifies to all the people leaders that, okay, I've got a lens. I may need to do something here at a unit or program level, but where do I start? And when you look to your strategy, it's that guiding light. And then addressing the what we know, a lot of us have probably heard the term wellness whitewashing, right? That's a lot of media attention to that term. And I'm actually going to sit here and tell you that it's out there. How I define wellness whitewashing. It hurts me a little sometimes when I see some of these articles, because I do a little Zumba on unit sometimes. I'm a Zumba instructor, but it's not about the Zumba, right? The Zumba is representative of they have a break. We have a wellness cart that goes around to the units, and they can grab education. They can have a conversation with us. It's been a really amazing way to build our organizational culture of wellness. Engagement is so important. But you have to get to root cause. And if the output is determined, if the unit is, say, wanting to do a stretch, great. That's what we do. If the leader wants to ask the team, do you want a team building session? Then we can offer that. I would also want to invite a thought that when we consider wellness whitewashing and all this media attention to that term, what model of wellness does the organization have? And I'm going to just say traditional, and by no means am I insulting any. I think there's value in all wellness programs in their shapes, sizes. But I think what we need to do moving forward is ask ourselves, is the traditional model, although it may be popular, maybe getting participation, we may be, seeing the memberships, if we have fitness centers or wellness centers, we may be seeing some revenue coming in to support these activities. But I would invite any wellness individuals on the call to ask, just to do a check-in. Maybe it's time to do a SWOT analysis on the program and ask ourselves, it's great. We're doing great with our education and activities as is, but is there an opportunity to get to that, to identify the root cause? But I do want to also stress that in doing that, we can never undervalue the feedback from the employees and the leaders. The feedback coming from the leaders is very, very important. They have to manage their teams, but the feedback coming from the employees is equally as important. And what I would encourage is that feedback comes together. So the leaders and the program leaders talk to their employees, and that feedback comes to us as the SMEs, the subject matter experts, collectively. And then we all work together to identify the root cause and then deliver the education and activity.
Thanks so much for sharing that. And I think, highlighted on certainly key points as to that, first of all, that North Star, right? Where's that guiding? Where's that framing, and making sure that we're all building it in different ways? Because I think, as you said, is first of all, listening, engaging, what will make a difference. And it might be multi-pronged. It might be very different things. And I think, certainly we've also heard the concept of joy at work, and engagement is one of the concepts within joy at work. And is it helpful to frame? I have heard different thoughts of important to be strength-based, but also, so just maybe Ainsley, thoughts on the framing and use of this? Any tips for organizations using this language?
Yeah, so I think I'm a big fan of the Joy at Work white paper from IHI. If you haven't read it, it is a good resource. But I've also heard that concept of joy at work does not resonate always with everyone. And I think, Philippa, you really nailed it here around what actually matters in the workplace is understanding what matters to the teams that you work with, and having a starting place of what does matter to you is really important. I think beyond joy at work, right? Because by having conversations about what matters to you, and it can be at an individual level, but it can also be at a team level. Because I just want to call in, there could be leaders on this call today that have 200, 300 direct reports. And I'm not saying that's okay, but I'm saying that's probably the truth. But you can also understand at a team level, have some of those conversations. I think when we reframe to some of those questions from that joy at work piece, you really start to understand what folks are looking for in their workplace. You start to breed trust and respect. And of course, I think, as Philippa, you also said, the proof is a bit in the pudding. So once someone takes the time to give you that information about what matters to them, then really using it collaboratively to put it in place. I think, it's true that things like pizza parties are getting a bit of a bad rep. Hey, I love a pizza party, but I know that a pizza party is not going to fix some of the moral distress or moral injury we see in the workplace. And your team will, though. The folks who do the work know the work best. They are best designed to make the improvements in that space. I think when I look at joy at work and that model, to just one of the ones that I really like to pull off the shelf is what are the pebbles in your shoes? So I find that to be a really helpful question. Sometimes coming with a question like what matters to you, so big, so broad. But I think pretty much all of us could identify what's that small little pebble that when I take 2 or 3 steps, I notice it, but doesn't really bother me. But as I start to take 10, 15, 20 steps, I really start to notice it. And it's those that I think start to add up. But if you can catch them as those pebbles, that really helps. So I think the joy at work is a good model. I think the word joy can be triggering, though, and activating. And so it's about a bit of a reframe there.
Yeah, no, thanks for that. And the notion of, we don't want to add more overwhelming, right? And certainly seen some comments in the chat about how joy has been used, framed, and being mindful at the same way. Thinking of that overwhelming, and even Ainsley, you talked about, it's caring for the carers includes the entire workforce, and that includes leaders, and many that are even maybe put into leadership roles, and that. So, and I know, Ivy, your toolkit also talks a lot about supporting leaders. So maybe if you can talk a bit and share a bit more with us about that, that'd be great.
Absolutely. Yeah, leaders play a really critical role in this. And in a review that I was a part of for the Canadian Academy of Health Sciences, in the chapter that looked on health workforce retention, the number one priority pathway that was identified was really about, engaging, supporting leaders to support others. And, so we think about, leaders also need to support themselves in the same way that we say, you need to put your mask on before you put on others. And I think that that really follows on sort of leadership frameworks like the LEADS framework. It's about leading self, right? Showing by example, but, being mindful about your own, mental health, your own self-care. Leading by example. Other parts of the LEADS framework, engaging others. As Philippa said, I'm 100% supportive of that. Workers are your greatest asset in this industry. So, training, being really mindful, servant leadership, listening to to the workers who have a different bead on all of the different challenges. And so that's really important. And then, creating a system where you're achieving results is also so important. And so in our toolkit, what we do is we had a bit of an allergic reaction as a team to the individual level. And so we flipped it on its head and we started off with system level interventions. And that we felt, would be where trickle down actually makes sense. And then we had under that organizational level interventions. So, and that really fits nicely with the achieve results, because it's how can you change things at an organizational level. Next is the team level. What are team level interventions? Again, how we can work together to improve the circumstances. And then at the individual level, it's mostly focused on what leaders can do at teams and at organizations and at a system level. So we really wanted to kind of flip the toolkit on its head. And in addition to having the toolkit, creating the toolkit, we've been reflecting on it, because we said our project has been about creating the toolkit, but engaging with folks in utilizing the toolkit. And what we're finding is that it can be overwhelming to see all of these different leading practices. And our team has done an enormous amount of work to sift and sort the best ideas out there. But if you're a leader and you're burnt out and your staff are burnt out and with, experiencing moral distress and all of these other things that we've been talking about, it's really helpful to have somebody like a Philippa, her role to provide a bit of a concierge service, to kind of go shopping in the toolkit and say, oh, we understand what's going on here. Here are some interventions that you might want to try on, right? Here's a short list of them. And, these interventions don't just need to be adopted. They could also be adapted. We could take them in here. We could let them out here. And it's really about creating a fit for purpose for your organization or team set of interventions. So that takes time. That takes investment, and that's exactly how you should think of it. From a leadership perspective, you should think about this as an investment. And the organizations that we've been working with, the leaders have been incredibly engaged. They've been vulnerable, right? Because they're having us come in and identify what the problems are in their organization. And some of that might be leaders, and in some cases, in some organizations, their leaders are the strength of their organization. So how do we then, enhance that? So leaders need to be leaderful. They can be taught to do that, just like all of us. We can all be taught, to do better self-care, even somebody like me. And we can lead by example, and we can engage others in that, because leaders don't necessarily have all the solutions. We don't really look at them to have all of the solutions. The more that you engage in this dynamic, I think the better that it's improved. So that's some of the kind of principles that have been embedded in the toolkit and how it should be used. So I think all of those roles are really important.
Thanks, Ivy. And certainly there was some comments there about thinking of any of these strategies from the meso to the micro level. And I think, as you've highlighted, your toolkit looks at that way, but even probably within each section too can look from a meso to a micro level. And certainly what you've highlighted there, I wouldn't mind hearing from each of you actually a bit of ties into a question that was percolating in my head as well as see it in the chat. But we also know that all this is existing, as Andrea said in the chat there, in a space of mistrust and a high emotional workplace. So what are recommendations about having some and navigating some of those difficult conversations? And that maybe, Philip, I'll turn it to you first, and from your experience in working.
Yeah, it's so interesting because when we were talking about moral distress just a little while ago, and I'm just gonna, if you'd asked me, so I started here in April 2018, and I came out of school and I was like, had my fitness instructor, and, pre-pandemic, came in, did my needs assessment, took the textbook, translated it into the workplace, and started my operations plan, followed the checklist. And then all of a sudden, I was very unfamiliar with being in a hospital, disability management at the time that it was called, meetings, injuries, absence support program, all this is very new to me. And I was like, oh, okay. And I sit under workplace health and safety, which is occupational health and safety to those that are still using that term in their organizations. And I was like, oh, okay, people are getting injured or sick, and non-occupational, occupational. I mean, obviously, things happen. But what really resonated with me was the standard, and just thinking about, wow, there's a lot more that makes sense when we, bringing in the psychosocial factors. But the one thing that I realized, my role has evolved so much from that. I mean, and I think I was even noticing it before the pandemic. I also support units that may have trauma, may have a critical incident. It doesn't happen very often, but I'm there. I'll go in we work very much in a collaboration with our spiritual and religious care team. They're registered psychotherapists. Because when I first started, it was just me. In fact, I was only part-time. And then my director and our leadership team brought me on full-time. And it was very, very difficult to, go through the pandemic without any EFAP, our Employee and Family Assistance Program. We couldn't bring in any support, as most of us are aware. So relying on your internal partners, even our internal mental health team at the time supported the staff. That's the big key, is you have to, I'm very passionate. I self-define as a very caring, nurturing individual. And I want to be there for the staff and the units as a team, but you have to rely on your partnership. You have to work together. And I also want to add, I know we've had a lot of talk about joy at work, and that model is familiar to us, but what I find has really helped me as somebody, being on the front lines, on those units, connecting with the staff through engagement and through our program activities, is looking at that quality improvement approach. Using the one thing the Joy at Work introduces that PDCA, that plan, that do, that check, that act. And that's very, that's the same as our wellness program, generalized program planning model. That is the same as a project planning model. And I think that's the functionality to kind of get to some of what you need to do. What does your output need to do? What is the risk factors that you need to address? And that, and taking it even one step further, I've also become a learning designer. So I've brought, now wear that training and development hat, and marrying that with the PDCA cycle, with the generalized program planning model, has enabled me, I believe, and I'm hope my organization feels the same way, to create a better wellness program lens that not only incorporates psychological health and safety, but that organizational development lens of training. Wellness is not just on our respective desks as an SME. We are an organizational conduit, I guess, or filter, however we want to define it, to the overall health and well-being of the organization to help impact absenteeism. I'm not going to sit here and say that my program has reduced absenteeism or has increased retention, but I'm proudly going to sit here and say that we're at the table. I'm very proud to be part of the people leadership and our people strategy refresh, which is currently under review. And it's the first time I present every quarter to our senior leadership team, and share our results, share our participation, share our engagement levels. And in my experience, that's never happened before. And our organization really takes wellness seriously. And now we're progressing, being at the table with our people leaders. We're now looking at that psychological health and safety lens through the entire employee life cycle. So there's many, many things. It's not, but it's a journey. I really want to stress, don't get discouraged. Just stay the course. There's going to be good days and bad days, but it's worth the effort, and just keep the conversation open. I do feel an immense amount of psychological safety myself with my leaders. And I'm very happy that I can have those moments, because they're equally as important to the successes. Sometimes you have to have a tough conversation. But recognizing what, I know that my passion and drive in our wellness strategy is fully connected to our strategic directions, but not just the organizations, also our EDI, our equity, our diversity and inclusion strategy and framework. I recently did a lunch and learn to talk about that under their Reclaiming Joy. So again, tying into to joy at work, and so the wellness lens is so important. And I think that the biggest thing, the biggest win we can have as specialists or coordinators or consultants or even managers is to invite that wellness specialist, however it's defined in your organization, to the table. And if you are not able, maybe you're hesitant, connect with one of us here, connect with your resources, and sort of figure out, how can I do that 30-second elevator pitch, or, do that, figure out what type of questions do I need to ask to bring psychological health into the organization.
Yeah, no, and especially how to, how collectively making that difference go, recognizing there's pebbles, there's some big pebbles, but where starting from Ainsley, Ivy, any thoughts? Certainly, knowing that it's not easy to recognizing that, to improve trust in a work environment, and also recognizing the environment that is working in a healthcare setting. Any thoughts to add?
Well, and I think that's what Ainsley was getting at, with some people have an allergic reaction to this concept of joy at work because they see that as unachievable, because they're in a toxic environment, and joy seems like a completely different country for them to get to. So it's about moving towards a goal, setting some targets, having those crucial conversations, and everybody has to give a little, and that's hard to do when you're all burnt out, because it feels like you have nothing left to give. And so that's why roles like Philip has is really important, to have sort of a broker there to kind of manage those things. I think we have to kind of figure out, how do we incentivize this, right? So that it's not considered to be a nice to have, that it's a must have, right? So how do we shift that? And, along the whole adage, what counts is what can be counted. Measures are really important. And measures, not just that, this is a nice to have, but make people accountable to those measures. We've all talked about the CSA standard. That's really important. Is that part of it? What are the key measures that we want to see? And, and Philippa, you mentioned that, you may not have reduced absenteeism, but what was the counterfactual, right? So maybe the counterfactual was even worse, right? So I think we have to kind of think about all of that. I'm not a health economist, but I understand, issues around the economy. And many colleagues who have been working in the health workforce space have said, if you have limited funds, retention is the best return on your investment. Investing in retention, the workforce that you have, right? What's really stunning to me, and this is work that we did with the Healthy Professional Worker Partnership, because we were interested in this issue of mental health, leaves of absence, return to work, is that, if you've left, there are really very few strategies to get you back, right? You're kind of gone. And that's hugely wasteful. It's wasteful to the system. It's wasteful to the investments in that worker, both their personal investment in developing their skills, in training and in experience, and wasteful from a public perspective because we've invested in their training and for them to get skills. So retention has the greatest return on investment. These types of strategies need to be seen as essential investments, and that we need to measure and have an agreed upon set of measures and be accountable to that, because the counterfactual is the most expensive. Right now, it's the most expensive way to proceed. Why do we know that? Because of the data that has been coming out on agency nurses and other agency health workers. That's the most expensive. It's wasteful money-wise. It's wasteful in terms of the skills. And so we really do need to shift thinking quite dramatically about how critically important these tools, these resources, these interventions are.
No, absolutely. Thanks for sharing that. And Philippa, I'm not sure if you've seen the chat, but there's must be some team members that are saying what you bring. So I think, as you said, I might not have the data here, but that's some qualitative data we're seeing coming in.
Yeah.
Ainsley, just some thoughts, just wouldn't mind as we continue on this conversation, especially thinking what we've heard. And I know we're going to chat in a bit, hopefully, as we get to it, because there's so many great questions coming in, but also talking about various roles. It is many roles and that play in making this happen, but really thinking from that, where you've come from the quality improvement in a healthcare setting to now at Switch BC, thinking from that meso, macro, micro level, and thoughts, knowing that how do we bring them all together?
Yeah, that's so great. I feel like there's so many ideas percolating and go in so many different ways. Me too. Yeah. I do think, and I'm seeing some of the comments, and I really love some of the comments around measurement at multi levels. And I would say, measurement is something that's been happening in occupational health and safety and patient safety and quality for many, many years. And we do have some standardized metrics that we can draw upon. And as Ivy said, there are proven interventions and activities that we know provide a return on investment to certain metrics. So we know that investing in mental health education and awareness, I recently saw a return on investment rate of 5.7 for activities related to just increasing education and awareness at keeping someone in the workplace. We know that well-being activities or wellness programs have an ROI of about 5.4. And then to Ivy's point, return to work programs only have ROI rates around 3. You can see that big difference of we need to focus on this while people are in the workplace and what that looks like. From a measurement perspective, I think we will start to see, hopefully, more national data start to be developed. I know that we have a new organization related to healthcare workforce, and I think as we start to see that come out, that will be really important. I think, I've started populating, going in a different place, Colleen. Sorry, maybe asking the question again. I want to make sure I answer it right.
It's just, no, all good. And it's good for the conversation to go whichever way. So I think, as you said, there's so much connected to this, right? Yeah. So I was just kind of thinking, and I know there had been some questions, really thinking that the meso, macro, micro, right? And I know we're going to talk a bit about, even that autonomy as within the workforce. And there's some questions we do see about what about the individual, and that recognizing, yes, there's system, there's organization, but what else is there? So just kind of trying to get your thoughts from the multi ways, but also making sure that there's coordination amongst them. So we're seeing them play together as well.
Yeah, I think, go ahead, Philippa.
Oh, sorry. I actually just wanted to add something to that because my spark is flying here. you know, when we hear about metrics, this is such a big conversation. I kid you not, I sat at school and I was told the metrics are the tough to measure. It's that, you know, logic model, it's a long-term quality of life. How do you measure that, right? And the thing is too, it's different from everybody because we could all be sitting here with stress. We can all be saying we're stressed at the work, but our triggers and our root causes are going to be different. So that's another reason why I love the needs assessment and audit that the standard can bring to an organization, right? And I know the commission's working on a new auditing tool, inside scoop, but the standard does talk about that as well, about when you go into the organization, you do a needs assessment. And even those of us, even a plan in the PDCA is that current state. And as a wellness person, I want to be a sponge to all the data I can get. Engagement surveys, informal feedback, formal feedback. The sooner I am told of feedback, the better it is. Even if someone says to me, I just cannot stand the Zumba, don't like it. Okay, that's okay. What do you like? What can we do for you? Right? Like, you know, it's so important that we look at this data. But the one big plug, the one big importance of the standard audit is it does give you that actual assessment of which factor is, say, the bottom driver or at the most risk, i.e. workload management, for example. I think that's one that we all have in common right now. And then it gives you the tools, and that it's up to us as the wellness SME or specialist, you know, such as our role is, to come in and go, okay, here, what can we do? What do we have in place in the organization that maybe just needs to be refreshed or revamped or recommunicated? And then where do we now need to invest those very precious dollars in our in our bank that we need to allocate? So that's all I wanted to share.
That's great.
Ainsley, anything else on that? Or
Yeah, I just wanted to build on Philippa's point because I think also it's really important to survey staff, understand where folks are at, and encourage regular conversations that normalize mental health and well-being in the workplace on a regular basis. But I'll also call in that if you're working in a more senior leadership level, there is data that's available as well at a high organizational level through, you know, for example, WorkSafe claims or worker compensation claims. They're going to demonstrate to you where you're seeing claims related to mental health. We know that mental health and claims make up about 30% of claims, but they count for 70% of costs. So when someone goes off on that, so you could be looking at some of those rates. I'll also share that looking at how your organization and your team members are using your wellness programs and even their extended health benefits is a really important indicator where you could confidentially gather that information. We're a pretty small new organization, but one of the things we did about a year and a half in is confidentially looked at where we were seeing folks using extended health benefits, and then making adjustments accordingly. I'd also encourage looking at where you offer supports at a systemic level. So I can only speak to our organization, but we felt there was a real sort of values rub when we noticed our extended health for things like massage and physical items were significantly higher than what we were offering for things like counseling. And so I think there's opportunities not just to look at EFAP, but to also look at what are the extended health. How is your workforce using what is being provided to them right now? And how can you lift it up in a really good way?
no, I think, and in building in that environment of trust, right? So as it is
That's right.
lifted up, it's coming from
Yeah.
that place of trust. Really interesting question that seeing in the chat, and knowing certainly as we're thinking more system wide, sometimes there might be, and even different settings of that we might not see our team members on a unit. We might be home care teams, community, we might be remotely distant from a team or dispersed over numerous sites. And certainly the example or the question that was shared with us in the chat. Any ideas of how doing this? And I'm not sure if there's stuff within some of the work you've done, not just this toolkit, but other stuff, and also supporting staff. to ensure a psychologically safe and well environment in this model when you're, as I sometimes say to my team, we're remote, but I don't want us to be distant. So, Ivy.
Yeah, absolutely. So those were two issues. So I want to first pick up on what Ainsley was mentioning. So one of the organizations that we are working with in our sort of concierge service here, helping them with the toolkit. One of the things that they noted is that they negotiated with their extended benefits to have a lot more flexibility. And that was really valued highly by the staff because, some, have a good relationship with their EAP counselor and want to continue to do that and wanted to have more than the 5 sessions in 1 year. And some of them really needed more of the physical aspects of wanted more massage therapy. And so instead of having these very sort of siloed, buckets with caps, they created sort of an overall cap. So you could kind of choose within this overarching bucket, which was really great. So that worked very, very well. And that is possible. So try to do that. One of our other organizations are working remotely, at different sites. And so there were a number of interventions that we kind of pulled together about, how they could create more connection. And one of the interventions is something called commensality groups. And what that is that groups would come together physically around food. And the organization provided support for this, provided support for the food so that you could bring people together, because sometimes, it's fine to be like on Zoom and that sort of thing if you've met somebody already and you've had a connection with them, so that, the Zoom can kind of, keep you connected, but every now and then you have to get sort of inoculated with some, physical interaction with folks. And so this is what they chose, this is what they invested in, and that seems to be working well. So we're looking at some of those issues. So based on what some of our organizations have been doing in terms of adopting some of these strategies, those would be a couple that I would mention.
Hi,
Thanks.
can I jump
Come on.
in?
Yeah, come on in.
Yeah, I love those, Ivy. We're a fully remote organization and have been since the beginning. And I would say, we try to bring folks together in person, because I feel like there's occasionally you needed that top up. That's not always, I know that that's not always possible in an environment of scarce resources. But one of the things that I think we've been trying to do that's I'm finding it really quite accessible and ties into that normalizing of mental health and well-being, is really starting to introduce it into huddle structures and daily conversations. And I think probably many folks, if you're joining through Healthcare Excellence Canada, you know about wonderful programs like safety huddles. You hopefully already have them in your in your team, in your organization. If you don't, I'm sure heck yes, they will have something for you. But really trying to normalize and have conversations about what's one thing that you're doing for your well-being today. So we have an organization check-in on Mondays. We talk about our weekend, we see how we're doing, see what's on the horizon for the week, and we ask, what's one thing you're doing for your well-being. And I think what's wonderful about that question as well is that you can slowly start to introduce just a little bit of a conversation, just a bit of an awareness. And what I find really interesting is you get a really wide, diverse range of items. So of course you've got folks, I'm going to do yoga today, but we've also got folks who said, I did meal prep yesterday, so I front loaded my wellness because I don't have to cook dinner tonight, and that's going to be amazing. Or we also have folks who are like, I'm going to spend 15 minutes just cleaning up this process map about how we do this because it causes me a real impact on my well-being. And I've heard folks in teams talk about like even cleaning up storeroom cupboards, right? Those are things that are little small acts that actually do have a meaningful impact on well-being that I think even in a remote environment, you can start to do it just a slow one drop in the bucket.
One drop in the bucket, and then taking that drop in the bucket and keep on spreading and scaling that. So I know we've got some questions that talk about scaling. Philippa, from your experience, I know anything you'd want to share as it relates to how to keep on scaling up and taking,
Yeah.
these practices from maybe a unit to the whole system within
Yeah.
the Scarborough Health Network.
It's interesting. I think the best way for me to answer that is just, share. I've been people have given me a lot of compliments about, having a great program and having a great, program. But I honestly feel like, well, thank you, but we're not done yet. And everyone looks like, what do you mean? And I said, not that I can't take a compliment, I appreciate it. But what I think we've done at SHN is build the culture of wellness. We've built organizational culture. And I am a firm believer that the engagement level we've had, obviously it was tenfold during the pandemic. I was on the front lines. I wasn't working from home. And I will say I'm grateful for that, because it allowed me the connections with the staff, with the leaders, with the unit as is. And I got a real world view of what goes on in the unit. I got to see and hear. And when staff have always predominantly defined wellness at SHN, what is well, I asked the question on all of our surveys, whether they were handwritten when I first got there to our self-checks, what does wellness mean to you? And I would say, just, I don't have the stats in front of me, majority of comments speak to my day-to-day. And again, that resonates with the risk factors of the standard. And then from that, we brought in preventative training for mental health, the working mind, which was extremely successful. And from that, we had a parking lot. I sat in every session, and I was that parking lot that literally, I'm the wellness person. I had built that rapport and an engagement with the staff and the leaders. And I committed to that content that maybe was, off the slides, to come back to the organization, to come back to the leaders. And I have fulfilled that commitment and shared it with the people partners. And even for our wellness program, we can constantly learn, we can constantly evolve. I want to encourage, staff to let us know what they need, so we can continue to build that conversation. And when I present to senior leadership every quarter, I share that data. I talk about psychological health and safety. I call myself that squeaky wheel, that literally rolls around with the cart. It's just continue the learning, continue asking questions, continue sort of self-reflecting your role and how, and connect with those leaders, even if it's informally. You see them in the elevator. Hello, I'm the wellness coordinator. Whatever it is, nice to meet you. How's your day going? Ask your immediate supervisor. If you're not at that table, just ask, can I get there, or can I give you a message to take to leadership? So I think
and I think certainly that notion of the culture of wellness, and even Ainsley, as you were talking about those questions you pose on the Monday morning, it's feeling safe to share. I just needed to prep all my meals yesterday. No, I need to fix this process piece because it is not making my working life. And maybe before over to you, Ivy, Philippa, would you be able to just share a tiny bit about the Working Minds? I know that program. Yeah,
oh, wow.
That'd be great. Thanks.
We put about 471 people in total through the Working Minds last year. We had a very generous donation from our SHN Foundation, Love Scarborough, and the Canadian Nursing Foundation, pardon me. And the feedback was tremendous. We decided to do them in person. And as you just heard me mention, I, decided that it was important for me to sit in every session to provide that place of comfort and reassurance because of that rapport I had built with the staff and the leaders. But also we really recognized that the organization needed to take that preventative lens. And the Working Mind training is just phenomenal. The feedback, people walked away. I've never seen engagement. We had people clapping after the first session. People were texting their colleagues saying, are you registered? You need to get registered. I had a wait list within the first 2 sessions. I think the lens of addressing stigma and what that means, the content is so incredibly digestible, the big 4 strategies. And again, they very much resonate with a lot of other things, like, setting SMART goals. We hear that in all walks of industry and business. So from that, we really learned about, what we're doing well, what we need to maybe buff up our communication on, and also, what else can we do? Where do we maybe need to use some of those, dollars to continue education and training? I can't speak enough, and we pleasantly surprised a lot of staff that this is prevention training. What? This isn't a reactionary thought. So definitely would recommend it to anyone on this call to just check it out and see if it's the right fit. I think the best way is look at your wellness strategy, look at the, and it does actually does introduce the standard and the factors. So if you are thinking about sort of hitting a few pillars, I think that this training definitely does support that.
But thanks for that lived experience of with the Working Minds, and we have put the link in the chat again. We will send it following our session today to all the resources, many that have been shared here. Really thinking of that scale and spread piece, but also that importance of engaging. We can scale and spread, but if we don't know the needs of those that are the intended beneficiaries, that's really important. And Ivy, wondering if you can talk a bit about some of those individual tools and that you have found through your work.
Yeah, absolutely. Because there is an important role for individual tools, but they shouldn't be in the absence of tools at other levels. And when we were scanning, we were finding that most of the toolkits, because our toolkit contains other toolkits, that those toolkits tended to be focusing on that level. So we were very selective of what we chose. So I think, like with anything, and I know Philippa comes from a background of health promotion, and health promotion has always sort of been a balance there of between individual and structural change, right? And so you want to make sure that you are empowering people to start with themselves. It's kind of like what I was saying, leaders to start with themselves, lead self, but we can all lead, right? We all have leadership capabilities and opportunities, right? So leadership is not just the person in the management supervisory position. Leadership is a set of capabilities that we can all build on. And so leading self is part of that. And so I think starting somewhere, engaging others, other colleagues that happen. And I really liked this notion of integrate it into your day-to-day. Whether or not that's you write something down or you say an affirmation, or just start with something. It may be small, but build it into your day-to-day so that it starts becoming, and it becomes a muscle that you exercise and it gets better. Reach for resources, right? And there's a whole bunch of resources that we've been sharing here, some of which are in our toolkit, some are others, like for some, maybe just reading an article and realizing, oh, I hadn't sort of thought about that. It means that you're going to be different and you're going to change your actions, you're going to change your behaviors, and that will be like a pebble, will have a ripple effect to those around you. And then they may then change, they may ask, oh, you're, looking great today, what's happening? And then you can share that with them. So reaching for resources, setting goals, really important, and getting kind of some feedback on those goals. A number of our individual strategies are reaching out for mentors, right? And that can be really challenging, but there's always something to be gained, not just from the person reaching out for the mentor, but the mentor themselves. This notion that we call reverse mentoring. They learn, you learn, then it becomes this dyadic, and then again, it's part of engaging others and spreading and scaling. So starting somewhere and building from there, right? Just start, right? We always say, things like, well, we should have done this 20 years ago or 10 years ago or et cetera, et cetera. Next best day is right now. Start right now with just something small, build it into your everyday, and then build from there.
No, thanks for that, Ivy. And certainly just that building, but also recognizing, the trauma that the workforce and just a comment that has come in within the chat. There's a lot of attention to the trauma of the patients, but there's a lot of trauma within the workforce, and certainly the importance of acknowledging that, but also programs to address that as well. So Ainsley, any thoughts on that?
Yeah, I think one of the, I guess I would say, wonderful things that I've seen in recent years in healthcare is the recognition of trauma-informed practice and care. But to, I guess, Jen's point, we haven't seen that lens shift towards understanding the trauma that healthcare workers have experienced over the past few years and how that impacts their ability to provide care and their ability to receive help and care and support. And so I do think that training programs that start to introduce trauma-informed practice and care, both for others and then for self, are really important. I think we are redoing the provincial violence prevention curriculum here in British Columbia, and one of our aims is to provide a trauma-informed lens on all of the training that we're creating in this space. It is important to recognize that we are all individuals too who walk in with trauma, and that can be trauma that's been experienced in the workplace, and I think it's really important to acknowledge that as well. I think as well, I know there's been a lot of leading work nationally. I think Healthcare Excellence Canada has been involved in this, also looking at areas and groups where we actually see a lot of post-traumatic growth and resiliency. So a few folks have also, just I quickly saw in the chat, how do you do engagement? How do you get leaders to sign on? Where do you start? I think it's also important to start that we can start from a place of positivity, and where we've got positive deviance. We don't always need to look to the units or areas or measures where we're doing really, really poorly. Sometimes it's just as valuable to look at where we're seeing groups or teams that are doing really well in this space, to see how we might be able to replicate and spread those activities. Because we know that there are incredible pockets of excellence and promising practices happening all across this country on teams. So starting to look from that appreciative inquiry lens, someone just said that, appreciative inquiry lens, I think is really important as well when we look to that piece. We also know that people respond better to positive starting places when they're looking at projects and pieces of work and looking at the solutions, rather than the problems, can be really good.
Thanks for that. And I recently was at a meeting and heard a lot about some of the work. I think it was through Fraser Health, and that some of the work that they've been doing, bringing that trauma-informed lens for the health workforce and that. So, and certainly we only have, I want to make sure we've got time, so I get some final key takeaways from each of you. So, and I know there's certainly numerous questions that we've not been able to get to in the chat, and we will be pulling those questions and certainly looking for some themes and looking to follow up. Again, all the resources and more that we've had ready that we will be sharing. And I think, I'd like to maybe just before the key takeaway, Philippa, just, and recognizing that we're all at different places along our own journey within this. And how do we recognizing that sometimes when we're looking to implement these programs and based off needs, that there's various needs within a unit, an organization, and that. So you're wanting to address everyone, but how do you do that I think one of the terms used in the chat was that mixed engagement. So, and any concrete examples from there?
I think when I think about what's defined as my successes or the success of SHN Wellness, and I think, again, I just circle back to that engagement. But I think I also want to touch on the fact that a big change in my job has also been supporting staff when they're in distress. Being that, I'm not a therapist or a counselor, and by no means that's always identified when I do a quote unquote wellness coaching session, but it's being in that active listening state, and it's providing that resources and supports as needed. I think that's probably the best way. You got to get out to your units. You got to get talking to the staff. You have to get some form of needs assessment. I think if you can do nothing else, look at organization or psychological health and safety or mental health, whatever lens you're being asked to adopt or produce or program. Follow a cycle, follow a model, pick the standard, pick joy at work, pick a SWOT, pick up a business administration textbook and go, I don't know what I'm doing, but right. It gets you started. Ask, either deliver a message to senior leadership via the appropriate, chain of command. Sit your leader down, sit the person that you report to and say, listen, I need to have a really honest conversation. And then, yes, we have limited budgets. Things that we've incorporated, things like wellness boards that are going up now. 24/7 access, because we all work in healthcare. We work this 24/7. I don't work 24/7. It's hard to get into the night shift. Look at what you have. You may simply only have employee and family assistance program. That's okay, right? There's a lot of resources within that. It may not be perfect. I just really want to stress. You may look at your SWOT or do check your lead self. Look, look at what you're currently doing and go, oh my goodness, I don't think it's great. That's okay. It is the foundation. You build up from there. I don't believe in failure. I believe in identifying gaps. When you're feeling down on the ground, there's only one way to go, and that's back up. But remember, it's a journey. You're not going to reach the absenteeism or the 100% retention, just by creating a wellness program, whether you're staying with the traditional model or moving into a more transformational model that incorporates either the joy in work or the standard or something else that works for you. I think I really want to stress that, actively listening, is so important. Yes, you have limited resources. You may be a team of one or a team of two, and you can't do everything, but that's why the data is more important. Adapt what you have already, though, right? It doesn't need to go away. It just needs to be adapted, but stay the course until that decision's made, right? And just keep plugging away. Data. I went to a conference a few months ago, and one of a successful, I think it was one of the financial services was asked, what data do you measure? And they gave one word answer. And the VP said, everything. Track everything. And I thought that was interesting. I said, yes, I'm doing it right. But and that because it will be needed. It has a piece in the puzzle that defines organizational wellness to your people.
Thanks for that. And certainly I think it talks a bit also about that economic context as well, and what that can demonstrate. And so much, and that the three of you have shared with us. I certainly know, Philippa, you just mentioned it a bit there, and we didn't really have time to really get into it a bit more, but also that important notion of teamwork too, recognizing though that some are not on a full team, and that they are a team of one, but there are certainly, for those that they are in a team dynamic, that important role that teams can play. I'm going to turn it to the three of you and it's going to be a rapid key takeaways, as like to say that notion of some thoughts that you've had from today's conversation, or final things you'd like to share with those of us here, and then our then I will say a few remarks because we really want to hear from you, all our participants, as to how this session met your needs or didn't meet your needs, and that so in order for us to improve our sessions going forward. So I'll first turn it over to Ivy.
Super, thank you. Yeah, great discussions. I've learned a lot. Thank you for all of the comments. I think I'm going to start back where I started at the beginning, that it's important to recognize the problems, recognize the trauma, recognition, right? But don't stay there. But you have to recognize this, right? The importance of not saying, you know, everything's better now. Focus on the solutions, and the solutions are not a one-off. They're not a checkbox. It requires hard work and vulnerability. And so you need to support people in that vulnerability. It's definitely worth the investment. And so I think if you have a continuous measurement cycle, you can see that your investment is paying off. Reach for resources, as I mentioned, partner with those who are a little further ahead on the journey. What did they learn so that you don't have to make their mistakes? So reach out. So the resources that you reach out for might just be, you know, a local team or your local health service. And so that everyone's kind of moving together in a kind of supported way, because the health workforce is really worth it. It's, you know, it's our biggest investment in our health system. And I'll end off with a little statistic that, you know, the health workforce constitutes 8% of Canada's GDP. And shouldn't we invest in them, knowing that? So thank you.
Thank you, Ivy. Philippa.
You know, there's a lot of nuggets I'd like to share, but I'm going to share, I think one of my biggest lessons being in this role, what I've learned is education, becoming a polymath. I'm not sure if you're familiar with that term. Knowledge, seek knowledge. My role, like I said, if you'd asked me 6 years ago upon graduation in 2016 from, you know, the health promotion program at Centennial, wouldn't have thought about becoming a training and development, learning design. Wouldn't have thought about occupational health and safety or mental health first aid, even though we did have Safe Talk. Through crisis intervention, trauma support, having that, I think it's so important. But I'm also going to recommend that, even though we're wellness SMEs, you know, even if we're doing off the side of our desk, learn about our business. The business model applies to every sector. Learn about it. Learn about the driving factors of organization, resources, sustainability, administration. All that plays a role. Taking the organizational development approach is so important. You know, recognizing that our job is, you know, I'm going to just talk about the continuum. I know it's part of the work of mine, but the mental health continuum is that going from the green to the red, but the arrows are going either way. It doesn't end. You don't start and end. And I believe that our job as wellness specialists is to help employees stay as close to the green as they possibly can, but also recognize that that's different every day. And we cannot just determine what education or what wellness outputs are going to be purely because, you know, that's what we think it is. We have to base that on the voice and change, accept change. Change has already changed after I've just finished saying the word. That's exactly right. So yeah.
the constant change, and as see in the chat, the notion of humble lifelong learners, really love that concept. Ainsley, over to you.
Thanks. First of all, thank you, Ivy and Philippa. I am walking away with some great resources today too, and some learning. So I feel really energized walking away. And Colleen, thanks for holding us up in such a beautiful way with your wonderful questions. I'll also thank everyone who dialed in. Many of you are healthcare workers, many of you are leaders. You've taken time away from your very busy days to commit to this. And I can't actually see you, but know that I do see you. And I'm really grateful that so many folks would take the time. This is really hard and at times scary work. And it's not quick work. And so just know that I'm kind of holding you in that space. I think I go back to some of the great comments both Ivy and Philip have made about sort of the how we do this. And even I think Paul mentioned it just in the chat recently. I think about a comment a physician made that we were working with around, how do you combat moral injury, moral distress, commit to worker well-being, and one of the things they said was, you got to ditch your suit, you got to ditch your scrubs, you got to ditch your coat, and I think coming together to look for solutions together is the way forward, like Paul said. So, and that includes patients and families who care very deeply about our well-being as well. So, thanks.
Thank you, Ainsley, for that. And again, a big thank you to Ivy, Philippa, and Ainsley for sharing your knowledge, your experience, your expertise with us, learning together with all of us. And a big shout out to all of you joining our audience today. You have taken time and probably could have felt you could have been in a lot of different places, and your commitment to this and hopefully your commitment to yourself. We do hope you found this session very informative, and as said, you will receive a follow-up email with links to the recording as well as resources, and your feedback is invaluable to us for future session design. So we ask if you can take a moment or two now to provide us some feedback on today's session. The team will have a poll that will come up on your screen, and we'll ask you to complete that. And again, do not ever hesitate to reach out. We will capture the chat. You can reach out to us by email for the HEC team. Also subscribe to our newsletter to hear more about other ways you can get involved or hear what HEC Healthcare Excellence Canada is doing. Once again, really big thank you for taking the time today and sharing this time together.